morning. I'm Janae Sharp, and I'm sitting down with Sachin Jain. Is that okay to call you that? Should I call you Dr. Jain?
No, Sachin Jain is good. Yeah, absolutely.
Perfect. I wanted to talk to you about innovation, specifically if healthcare innovation is real, how it's progressed in the past few years, and if it's in a bubble. We hear about it a lot in this space, so I wanted to hear your perspective.
So, I believe that we have a healthcare innovation bubble. I think we have kind of the two different layers, is what I kind of call them. One is, kind of the reality layer. And then I would say then there's like the cloud layer above the reality layer. And I think most of what people call, innovation in healthcare resides within the cloud layer. And most of where healthcare is delivered is the reality layer. And I think it's always sobering for people who are working on the innovation side of healthcare to actually seek it or need it. And then they realize how messed up it really is. And I think one of the big problems is healthcare is really a heavily networked delivery model, meaning there are kind of strong ties between different unrelated entities, weak ties between unrelated entities. And you might be able to change one part of the equation, but then you almost always have to escape and go into some other part of the equation, which may be, kind of stuck in a legacy world. And right. So I think that is the reason why healthcare innovation is as incremental and as modest as it is.
Yes, I think it's interesting what you were talking about when you try to go and innovate for a specific problem. How have you done that in the past? How do you select your problems? How do you, because there are tons of things to work on. So how do you focus on one thing?
I think you got to look at the biggest pain points in your organization. So every organization I've been a part of, there's the stuff people like talking about, and then there's the actual real world problems. And, I'll just talk about some failures before I talk about some successes, because I think the failures are far more instructive. I joined Merck as its Chief Medical Information and Innovation Officer, in 2012. And I was essentially hired to solve a problem that the organization didn't really have. And what I mean by that is that, Merck had a lot of, I think, things it needed to do, and improve its digital capabilities was probably somewhere in, the bottom 50 of all of the problems that the organization needed to solve at that particular moment in time. And so, you create almost a target on yourself when you come into an organization and you're focusing on kind of a set of problems that most people feel are non-core to the real problems. And so I think a big part of what one has to do when they're leading in an organization is choose the right set of problems to attack. And now I'll, if you'll let me, I'll share some success stories. I mean, when I was at CareMore, we had identified member transportation as being a huge issue for us, in that we were eager to provide our members transportation, but many of the transportation vendors that we worked with didn't do a very good job delivering our members to their appointments on time. Mm-hmm. And so we were the first, health plan entity in the country to actually partner with Lyft or Uber. And we were able to dramatically improve service times as well as reduce costs, because it was a problem that was widely recognized in the organization. Similarly, we built some of the first clinical interventions in the social isolation space when I was at CareMore. And again, it was something that people got excited about and were galvanized by, because it was a problem they were seeing every single day in their clinical practice. And so, building a friendly caller and friendly visitor program to address the needs of lonely older adults just made sense to people, because again, it was a problem they were experiencing and seeing on behalf of their patients every single day, for which we had no solution. Now think about, all of the innovation, so-called innovation and digital startups that are kind of, emerging in the healthcare industry. Many of them are solving problems that we don't really see as top of mind or top of issue problems. Now that sometimes is related to problem definition, right, and whether we've done enough work to actually build the case around whether something is a problem or not. But if you're trying to lead change in an organization, you got to go to where the problems are. Jesse James said, he robbed banks because that's where the money was. If you want to be a change leader in healthcare, you have to go to where the problems are to actually, create real change.
I wondered about that too. Like with things that I've worked on, sometimes people aren't ready. Like we came into healthcare talking about physician mental health, 2 years before anyone seemed to care. And I'm interested in that idea that you go where the problems are, or like where people identify that, but our frame of reference as individuals isn't always like spot on. Like,
well, yeah, and I think I think it's really important for someone who wants to be a change leader in healthcare to put themselves in a bucket. Am I solving a problem that everyone recognizes,
right?
Or am I someone who needs to now build the case for solving the problem? I know you've done amazing work in physician burnout and are now kind of filling a huge need that people have identified coming out of the pandemic. I had a similar experience working on the issue of racism towards healthcare providers, which when I first published about it in 2013 in the Annals of Internal Medicine, first of all had received rejections from the New England Journal and JAMA because they said, either they didn't like the way I wrote about it or they didn't really see it as a problem. Fast forward 9 years, and I think everyone recognizes that racism towards healthcare professionals is both an issue as well as an abomination, frankly, that something that we need to correct. And so again, you just have to make sure what phase of problem solving you're in. Are you in the build a story phase of problem solving, or are you in build a solution phase of problem solving, which I think are two, frankly, very different phases and have different playbooks, assigned to them. I was a political science undergraduate, and there's a great literature on this stuff, actually, on problem definition. Scholars like John Kingdon and Deborah Stone, wrote about, kind of the nature of how problems are both defined as well as solved. And, the story is that how you define a problem ultimately influences how you solve the problem. And so those of us who want to create change have to really be thoughtful about how a problem is defined, because how that problem is defined ultimately influences, how it actually gets solved.
Yes. And the definitions both for racism against physicians and providers and against mental health, like those definitions are drastically different now than they were when you started. You did it before it was popular.
Absolutely. So
when people are coming to innovation or see a problem, do you feel like there are tenets they should follow, or a specific I don't know, like a code? Like it sounds like you have like a very solid process. And I'm going to copy it, and I'm going to have everyone else copy it.
Well, it starts with really not focusing a ton on who gets credit. I think that's where a lot of people go wrong. A lot of times innovation is code for, I want credit for leading change in an organization. And I think if you're actually interested in the credit, there's one set of playbooks that you have to operate under. If you're interested in actually creating the change, then you have to make it everyone's work, and you have to make it everyone's problem, which in some case means putting yourself in the background a little bit, and oftentimes organizing others to lead change, as opposed to you being the person who's driving the change yourself. And so I think about the old adage, if you want to go slow, do it alone. If you want to go fast, do it with others. I mean, you really have to kind of, I think, find a way to do it with others. I think that's an important part of an organization. A lot of people, shy away from this because they say, I don't want to really get involved in organizational politics. But you have organizational politics as soon as you have more than one person in an organization. And so you just have to be really, really thoughtful about getting that piece of it right. I think, the other piece of it is making sure that there's a real business model and that it aligns to the business model that you're operating in. And it has to be material in the broader sense of the organization that you're operating in. So Janae, if you, let's take burnout for a second. If you said, let's solve burnout for burnout's sake, you might get a little bit of what we've gotten, which is yoga classes, seminars, issues, meetings about the topic, and you may spend 5 years doing that. If you said burnout was a driver of whether we can actually operate our organization, that burnout actually ties to
nurses, for example.
Burnout ties to turnover turns to productivity loss leads to lost revenue. All of a sudden, there's a different story around it. So I think it's, again, building a case that ties to the thing that's important for the top level leadership of an organization. And then I think there's also just getting comfortable with a lot of trial and error, and recognizing the difference between healthy persistence and insanity. And so again, we have to be willing to kind of change our playbook, from time to time, and oftentimes we're not, right? And so I think
there are some zealots. I might be one of them a little bit.
It's true.
I'm like, no,
true.
We'll change the system to make it work.
But a healthy dose of self-reflection on what is needed in a particular situation to drive change, to lead change, I think is super important. And having a group of external advisors who can potentially even help you see your own blind spots is very, very important. And I'm always kind of leaning on my mentors, friends, my mentees from time to time, to just get different perspective on what I'm seeing play out, organizationally or industry wide.
Yeah, being a leader who listens has a greater impact on your effectiveness. You should get credit though, because you have done innovation and done work in the equity space. Now you're continuing that work. And so I wanted to ask you a little bit about that. Like, when it comes to equity or accessibility, how did you, why don't you tell us about what you've done and how that process worked?
Well, we focused on a big problem in our organization, which was different rates of medication adherence between our African American Latinx members and our Caucasian members. And, we wanted to create change. And, we suffer from all the issues that most healthcare organizations have. We've got a long list of problems. SCAN has a long list of issues that we want to address on behalf of our members. And, healthcare disparities is but one of a number of different issues. So in order to really create focus around it, we actually did what any rational group of people would do, which is we put our money where our mouth is. We actually tied our annual incentive bonuses to whether we were actually able to close the gap. And I can tell you, we spent the first 6 months of last year thinking that we were on the right track. And then when we looked at the data, we realized, like, oh no, like we're at risk of not closing this gap. And in fact, not at risk of not achieving a 10% portion of our annual bonus. And so that became very real, very fast for our teams. And then, all the kind of normal issues that organizations face, inadequate resourcing, organizational sludge and politics, kind of all went out the window, because we were all unified by this common purpose, and doing the right thing for the people that we serve, but also the fact that we had our own skin in the game as far as actually solving this problem. And we saw, as a result, real movement, and we were able to actually close the gap by about 35%. So it was very, very, very exciting.
That's good. Congratulations.
Thank you very much. Thank you.
What do you think led to that? Do you feel like organizations can create that inflection point where they sort of, throw out their ego and start getting to work?
Yeah, I think it requires more leadership in healthcare organizations, Janae. And I think we have a lot of people who think of themselves as leaders in healthcare who are actually administrators. And they are, people who kind of organize groups of people to do things. But sometimes organizing people to do things also requires an element of revolutionary zeal. And it also requires a little bit of courage. And I sometimes have this question as I sit in different boardrooms, that I'm a part of. And I think, would a Gandhi of Martin Luther King have actually sat on a board? And if they did sit on a board, what would they look like? What would their conduct look like? And I'm sure they wouldn't be going along to get along. And I think a lot of people in so-called leadership positions in healthcare really go along to get along. They're more interested in kind of survival, organizational perpetuation, self-perpetuation than they are in necessarily creating real change. And that's a hard thing to look at yourself in the mirror and realize about yourself. It's a hard thing to say out loud about myself or other people. But at the end of the day, it's true. We sometimes aren't courageous where we ought to be courageous. We aren't, change oriented where we need to be change oriented. We are going along to get along. We're saying the thing that the person in front of us wants to hear instead of saying the thing that they need to hear. And so I think we have an obligation as leaders in healthcare, people who have influence over people who take care of people, to actually be focused on more of the right things and fewer of the wrong things, which sometimes means creating conflict. It sometimes means, addressing uncomfortable truths about ourselves and our organizations. And that's a different way of looking at it than I think most people think about their roles, which is oftentimes to just follow the leader, follow what they're supposed to follow, not recognizing that they may or may not be participating in some ways, in their own kind of moral injury, because they aren't necessarily doing the thing that they need to do to create the change that needs to be created.
Yeah. I know for me recently, I had an experience where I realized someone was like, well, that kind of makes you look weak. And I was like, well, I am weak here. Like, this is beyond my capacity. And it was really eye-opening to see what happened when I asked people for help, like on our board and advisory board. And it went really, really well, but it was also like intensely uncomfortable to just be like, well, this is just not something I'm going to do.
Yeah.
So I wonder how do you as a leader deal with that? Are there situations where you've had to be like, this is a no for me?
It's the kind of thing that causes me to lose sleep, frankly, is, making sure I'm being fair to myself, fair to my organization, fair to my leaders. So that's the work that we have to do.
Yeah. I'd love, we're running out of time, but I'd love to hear, a lot of people have questions about the payer space co-creating something with a healthcare delivery system. Sometimes it seems like two separate worlds, like they'll never cross paths, especially if you're in the healthcare system trying to find out if you're covered. But how have you worked with systems, or how have you brought those different people that you mentioned together?
I think a lot of it has to do with finding common pain points and, common problem areas. And I think we're all struggling in a competitive environment for growth. We're all struggling to create differentiation that makes us more attractive to different populations. Something I'm actively exploring with health systems is, taking a look at specific ethnic populations in Southern California, the Korean population, the Vietnamese population, who have long been underserved by traditional healthcare providers, and asking, how do we create an end-to-end experience, both from a health plan as well as a healthcare delivery perspective, that creates, meaningful change and value for patients. So it's those types of things.
Yeah. Well, thank you. I didn't know if you had anything else you wanted to share. I love your work, and I'm really glad that you were able to come and share some of that with our audience.
Well, there's a lot of mutual admiration. I think your work on burnout, as we talked about, was kind of before its time. It's kind of everyone's favorite topic these days, and but I think it's something. I think what is most important is that we create a set of problems that, regardless of where you sit, what role you're in, whether you're in the health plan side, the nonprofit side, the for-profit side, is important. We have a lot of those problems in healthcare, these are problems that are cross-cutting, like burnout. So to go back to your original question, how do you create change? It's really about, figuring out what that burning issue is, and then drawing the lines between that issue and the relevance. I think you've just done an amazing job of that. So grateful to be on this journey with you.
Thank you. I'm grateful too. And your work with health equity it's great. And it's a great example for me and for everybody.